What are some of the expectations for returning to a normal lifestyle, getting back to work? And what are some of the expectations about scarring? So anytime we do surgery, we expect scarring, and there's really no way around that, but there are ways that we can help a scar along and mature as best as it possibly can. As far as going back to work or getting back to a lifestyle, your normal lifestyle, whether it be working out or taking hikes or, just doing odds and ends around the house, that really requires an understanding of normal scar maturation. So I like to tell folks and give them a little bit of anticipatory guidance about their scar timeline. So immediately after surgery, whether you're using dissolving sutures or stitches or non-dissolving, there's always going to be a degree of inflammation that usually maximizes at around 2 weeks. So what is inflammation? How do you define it? Well, redness, swelling, some discomfort, and some warmth to the skin. Those are kind of the hallmark features of inflammation, and we expect that. Around up to 6 weeks from the time of your surgery, a lot of people will characterize daily change, where they're seeing something different than they saw the day before. And that's also very normal. That really reflects all of the remodeling of the scar tissue that's happening both on the surface and also beneath the surface within the scar. Between 6 weeks and 3 months, that kind of daily change shifts, and it really slows down quite a bit. You might see weekly to biweekly change. And then certainly between 3 months and 6 months, there's really nominal change. By 6 months, most people can't really tell from 6 months to a year out, looking at the incision, that there's any appreciable difference. That being said, scars are constantly undergoing change all the way up to 12 to 16 months. And so being cognizant of that fact and also being patient with your recovery process is just as important to manage folks' expectations and what's considered normal. Also going back to your activity and your lifestyle really depends on the anatomic location. Without getting too much into the weeds, I'll defer that to the discussions between individual patients and the Mohs surgeon or the skin surgeon, because those are really unique circumstances, and I think everybody has a slightly different take on.